Taking a genetic test is your choice, and you should never feel pressure into taking it by health professionals. It is also a long process which can involve several sessions with a genetic professional and several weeks, in some cases months, waiting for the results from the lab, from the laboratory. You may be given information that is very new to you and quite complicated, and it can be difficult to take it all in. It's a good idea to take a support person, a friend, a partner with you to your appointment. You may want to ask them to take notes during the appointments. It is important that you have the chance to discuss genetic testing with a trained genetic health professional. They will be able to provide you with all the information you need in order to make the decision that is right to you. They will also be able to help you discuss any emotional issues that may arise, answer any questions or concerns you may have. Uh, we should remember that there is no going back after you receive your test results. There is no way to unknow your result. It is important, therefore, to try and think through some of the main issues before making a decisions. Some of these are discussed, and it is important, however, that to point all the situations in the when we give some counseling to our patients. So it is important, for example, when they ask me if there is a way of treating or preventing, in this case, the disease, it is important to find out whether there is a treatment available or way or reducing the risk of developing the condition. If you were found to have the faulty gene, for example, knowing there is a treatment available may help in your decision making. For some disorders, there is no cure. The condition can be managed through drugs, some pacemakers, in some cases surgery. For other conditions, there is no treatment available to slow the progress of the disease. However, some of the symptoms can sometimes be partially managed. uh, the benefit of knowing you have the faulty gene may be more of an emotional benefit, or it may help with planning for the future. Predictive test results carry a degree of uncertainty, even if very slight. Having the faulty gene usually means that there is almost certain that you will go on to develop the condition. However, it will be still be difficult to predict when the condition will develop, how severe it will be, or how fast the symptoms will progress. It is important to remember that in scientific terms, a positive result test means you do carry the faulty gene, and a negative test means that you do not carry the faulty gene. Most often, the results will be one or the other. But sometimes there is a third possibility, a gray zone or an intermediate test result. This means that even though a change in the gene is found, it is difficult to know whether, in this case, it will be the condition. This is usually rare, but can be very frustrating, some kind of frustrating result to receive. So it is important to discuss all these possible outcomes with a genetic specialist when you decide whether to take the test.